Hello, I'm Julie Yalden. I'm the named nurse for Safeguarding Children, and today I'm going to explain to you about Gillick Competence and what it means to us in the service. So you may ask, what is Gillick Competence? Well, Gillick Competence is a term used in medical law in England and Wales to decide if a child or young person can consent to medical treatment or therapy without the need for parental permission or knowledge. Medical professionals need to consider Gillick competency if a young person is under the age of 16 and they wish to receive treatment without their parents' or carers' consent, or in some cases, their knowledge. It is important to involve young people and families in all decision-making processes, whether they are considered Gillick competent or not. If the young person has informed their parents of the treatment they wish to receive, but their parents do not agree with their child's decision, treatment can still proceed if the child has been assessed as Gillick competent. Gillick competency provides guidelines for professionals working with children and young people, which can help to determine the correct balance of respecting a child's and young person's wishes whilst maintaining their safety. A young person who is deemed Gillick competent has the right to have their views, wishes and decisions respected. If a child is considered to be at risk of serious harm, then parental involvement may be considered in order to maintain the child's safety. It might be useful for us to consider the history behind Gillick competence. In 1982, Victoria Gillick took her local health authority and the Department of Health and Social Security to court in an attempt to stop doctors from giving contraceptive advice or treatment to an under 16-year-old without parental consent. The case went to High Court in 1984, where Mr. Justice Wolfe dismissed Miss Gillick's claims. The Court of Appeal reversed this decision, but in 1985 it went to the House of Lords, and the Law Lords ruled in favour of the original judgment delivered by Mr. Justice Wolfe. Whether or not a child is capable of giving the necessary consent will depend on the child's maturity and understanding and the nature of the consent required. The child must be capable of making a reasonable assessment of the advantages and disadvantages of the treatment proposed, so the consent, if given, can be properly and fairly described as true consent. So how do we assess Gillick competence? There are no set questions to determine if a child is Gillick competent. Instead, various factors must be considered, including but not limited to the child's age, maturity and mental capacity, their understanding of the issue and what it involves, which should include the advantages, disadvantages and the potential long-term impact. Their understanding of the risks, implications and consequences that may arise from the decision that they have made. How well they understood any advice or information that they had been given. Their understanding of any alternative options that may be available. Their ability to explain a rationale around their reasoning and decision-making. If you would like additional information, on this slide you will see there's some hyperlinks to some useful sources of information. Additional information will also be available on our Hampshire CAMHS website.